Hello, this is Luann Belay. I'm the VP and Chief Nursing Officer at Get Well Network and the Vice President of Content. Today, I'm going to share just a quick presentation with you to talk over our monkeypox response. While COVID-19 took the world by surprise, it challenges us to always be prepared for the unexpected. Get Well has been committed to facing global challenges head on. While we and the public have a greater understanding of COVID, our healthcare systems are still recovering and it's not fully yet contained. We continue to work directly with healthcare organizations to continuously improve our tools while supporting patients, families, and our frontline workers. Our aim is to help reduce the burden and to promote wellness. Our work and that of our client partners has been referenced in many reputable publications, including JAMA, the Health Information Technologies Journal, and JMIR, and many, many more. But now, with a new health emergency being declared, we have applied our learnings from COVID to rapidly produce a solution ready now for the market. We are facing monkeypox. So what is monkeypox? We're actually doing a 21-day loop. It's designed for anyone who has an active infection or known exposure. It's providing trusted healthcare information related to the disease process. It allows access to important resources in real time, and it can be customized to add specific health information. It provides the user with the ability to self-input data, which the healthcare system can then monitor. So let me pause for a minute and let's take a quick look. The 21-day loop is designed for anyone who has active infection or a known exposure. It provides trusted information related to the disease process, and it provides access to important resources. This can be customized for any specific healthcare organization as well, but it starts out with sharing kind of what monkeypox is. It goes over the most common symptoms and provides some reminders that this usually is milder and it rarely causes death. Additionally, it's really important to understand how the virus spreads. This is something we learned with COVID. Teaching people early on how they can get person-to-person contact is really important. Additionally, there's some common information around pregnancy just to call out on the bottom. So this is an example of just how we take the information that we've learned and provide it in the most valuable way to all of our patients and families. Again, preventing the spread being the most reasonable way to help to stem this infection, we want to make sure people understand what they need to do if they have an active infection or a known exposure. So isolating at home, staying in separate rooms, using a separate bathroom, again, kind of staying away from the household pets, really important. You can get this from contact from bed linens, for example, from someone who has been infected. So it's important for us to make sure that they are aware of that. And finally, checking the symptoms. It's really important to check the symptoms on a daily basis to know if things are getting worse or better. If you do have monkeypox or live with someone that does, we also want to provide some information for them. So helping to share that with folks that are living in the household, making sure people know not to share items, not to share drinks or utensils. And most commonly, washing your hands with this infection is super important. So being able to reiterate that for our patients and families is super important. So let's get started with the symptom check. Symptom check is very quick. It takes less than a few minutes to complete. We start out with the most common symptoms, feeling fatigued, backaches, joint aches, and headache. And you'll note that if the symptoms are getting worse, there's an opportunity to alert the healthcare team. This helps with the triage process. If you've checked your temperature, we're asking you what that temperature is. Has it improved or is it getting worse? Are you taking medication, for example? So again, if it's high and you're taking medications, this can contribute to alerting the healthcare team as well. That's going to help them to understand which patients they need to reach out to first. Checking for swollen glands. Swollen glands is something that a lot of people don't know how to do. So we provide step-by-step instructions of how to actually check lymph nodes. And then we want to understand, are they getting worse? Are they getting better? Have they just started? And then finally, understanding the rash and the progression of the rash. The rash usually starts as flat spots and then it becomes filled with blisters, and eventually those blisters scab and then they fall off and new skin starts to grow. So it's important to understand at what point the individual is in the progression of this rash, This is going to help our occupational health departments to understand if they're using this with employees, for example, whether or not that employee is ready to return to work. This can also help to reduce phone calls, help to reduce the burden on the healthcare team. Finally, once you finish the actual symptom check, which only took a couple of minutes, we give some specific directions that if things are getting worse, if you have more questions, you can leave those questions here. And we reiterate some of the important steps regarding active infection. Once they're finished, they're going to be taken right to their activity feed where they can learn a little bit more about monkeypox. You'll see some of that information is repeated here. They can also click on links to other resources to provide them with real-time updates and information regarding traveling, health, updates to the potential disease process as we continue to learn more and more about monkeypox. We know isolation can be difficult, so we have the opportunity to provide some additional information to help patients cope during the isolation process. Things like learning how to do mindfulness or progressive muscle relaxation. We want to thank our partners at LifeBridge Health who have helped to provide information, are actively using the monkeypox loop, have provided some QA services for us as well. If you're interested in activating the monkeypox symptom monitoring tool to support your occupational health department, or you're interested in this for patients, please contact your client service manager for more information.